Hey everyone, Gail and I are here with three clinicians. All of them were on the front lines of COVID when it first started and are still there. And we are going to hear their stories.
So I'm Dr. Gold. I'm a third-year cardiology fellow at Mount Sinai, where I also rotate at Elmhurst Hospital, and basically was deployed pretty immediately in March to help Elmhurst, battle COVID.
I am Dr. Arabia Mullet. I am an emergency medicine physician for God knows how many years. I was initially trained back home in Cuba. So this is not my first rodeo with working in a pandemic. I work in Brooklyn at Brookdale University Hospital, which serves several communities as East New York, Brownsville, Flatbush, Canarsie, and Starrett City. And as a matter of fact, the numbers had came out that we were actually hit the hardest in the entire state of New York and had the highest rate of deaths and was largely ignored for several weeks.
I am Ray Lorenzoni, pediatrician trained at Montefiore and currently training in pediatric cardiology at Monte. The Children's Hospital up there serves all of the pediatric cardiology needs for most of the hospitals in the Bronx. And the Bronx, as many of us know, was particularly hard hit by coronavirus as well.
So each of you was on the front lines, and now many months later, what stands out about that time?
I primarily worked on the front lines during March and April when it was the worst in New York City. One of the floors of the Children's Hospital was converted to an adult unit to take care of coronavirus patients. The unit, basically, as soon as it opened up, was filled with adult patients, and many of us hadn't taken care of adult patients in close to a decade. And this was, we had to relearn adult medicine. We had to relearn respiratory management for these patients, and we did. I think the most touching aspect of that time was a lot of the humanity that came into it. A lot of the times it was a single physician going in and out of rooms to try and minimize exposure, and so that physician knew most of the patients. And when I was that physician, it was tough. You sat down with patients, you explained the situation, you obviously tried to comfort a lot of their fears, but both you and the patient knew that everything that could be done was being done, and that there just weren't a lot of answers.
The thing to know about Elmhurst is that it is a city hospital that is basically operating on a shoestring budget with, it's basically at maximum capacity always, and always kind of gets by the skin of its teeth. So to all of a sudden have, literally hundreds of COVID patients per day flooding into the ER, and then making their ways to the floors, the system was completely overwhelmed, and it transformed the hospital into a place that was, basically unrecognizable to me. But the thing that kind of anchored me was the fact that basically everybody in the hospital pulled together with a heroic effort. From the attendings, in their 60s and 70s coming in to med students, to nurses just absolutely selflessly gearing up and feeding patients and doing the vent setting changes, and right down to the cafeteria workers and janitors, who didn't miss a beat.
I will say that what stood out the most was the pandemic of racism that came out of this pandemic, where disproportionately Black and brown people had died from this pandemic, and not just because of the virus itself, more so because of, I would say, systematic racism, institutionalized racism. I work in a very poor resource community, a level 1 trauma center in Brooklyn. And I say this because there is institutional disparities. Depending on where one lives, that hospital may have the resources. And there were reports that there were certain hospitals that were in more affluent neighborhoods throughout New York City were able to receive financial backing, whereas hospitals such as the hospital where I work at did not necessarily receive a lot of support initially. I think that New Yorkers, we did the best we could. We pulled through. Unfortunately, many people had died from the nursing homes as well. But, you know, we were in a medical war zone. Like I have mentioned on CNN and Dr. Oz and many other outlets, that we were in a medical war zone. We still are. But I will say that, you know, New York definitely pulled through. And it wasn't just the doctors and the nurses and other allied healthcare professionals. It was the community.
First, a huge thank you to you three for your service and what you guys did through a pandemic. And really, you guys were the heroes through what we saw in New York.